Welcome back. As the world marks International Nurses Day, we take a moment to recognize the dedication, compassion, and resilience of nurses who play a vital role in our healthcare system. We're now joined by registered nurse Josephine Anjolo to unpack the realities of nursing in Namibia, the challenges faced in this profession, and the impact that nurses continue to make in communities across the country. Nurse Anjolo, good evening, and thank you so much for joining us here on the Daily Roundup.
Good evening, Tanya. How are you?
I'm good, thank you. How are you doing?
I'm very good.
Well, thank you so much for joining us and jumping right into our conversation. Tell us what International Nurses Day really means to you on a personal level.
Okay, thank you so much for the question. When it comes to the International Nurses Day, it's deeply personal to me. It's not just a date on the calendar. It's just at 6 to the 12th of May. It's a moment of national reflection and a professional reaffirmation. Personally, it reminds me of why I founded my clinic, which is Queen's Health Clinic, and why I have dedicated myself to this calling. And it's a day to honor the hands that deliver our babies, comfort the sick in the dead of night, and hold the hands of the dying when family members cannot be there. As a chairperson of the first Namibian National Nurses Seminar as well, this day also represents a platform for unity and voice. It's a day to celebrate our resilience as nurses, but also to amplify our collective call for investment, respect, and recognition. To me, it's a day of pride mixed with purpose, a reminder that our profession is both a science and a sacred trust.
Well, when we look at the Namibian context, talk to us about some of the biggest challenges, that nurses face in today's healthcare environment.
Okay. In today's environment, presents a triple burden of a lot of things. The triple burden of diseases, resource constraints, human resource shortages, and the biggest challenges include, firstly, chronic understaffing, which I am so proud of that it's being cleared, and unbearable workloads, which leads to burnout and a mental health crisis amongst the nurses. Secondly, we face critical infrastructure and equipment gaps. We cannot provide a 21st century care with a 20th century tool. So, thirdly, there's the invisible challenges like workplace violence, bullying, and a lack of mental health support for nurses themselves. And in Namibia, the vast geographic compounds these issues often. Nurses in rural areas carry a burden far heavier than their job descriptions, acting as doctors and pharmacists and counselors simultaneously. And finally, I believe a major challenge in the gap is continuous professional development and the slow uptake of specialized nursing roles, which limits career growth and retention.
How do these challenges affect, healthcare services in Namibia? Perhaps you can describe the state of public healthcare services in Namibia from your experience.
Okay. From my experience, the state of public health care in Namibia is a story of dedication despite adversity. We have committed cadre of professionals achieving a lot with very little, particularly in primary health care. However, the system is strained. We are operating with the aging infrastructure, frequent stock-out of essential medicines, and a referral system that often bottlenecks or delaying critical care. Yet, I've also seen hope, though. The Ministry of Health and Social Services has shown willingness for most of the support that includes dialogue and all that, which is why most of the platforms that are coming up for the nurses are quite crucial. My honest assessment is that we have the policies and the national health strategies on paper, but the gap between policy intent and the lived experience of the nurses on the ground in a clinic deep in the village of Kunene or Zambezi remains vast. Our system is still reactive, not proactive, and is in desperate need of a shift toward comprehensive primary health care that trusts and addresses social determinants.
When you speak about this comprehensive shift that needs to take place, then what do you think it is that governments and stakeholders can do to improve the working conditions for nurses in Namibia?
Okay. This demands a multi-sectoral, or I may say all of society approach. Firstly, urgent investment in human resources. We need aggressive recruitment, which I appreciate because it has started and it really went well. And upgrading of posts and a clear career progression framework from specialty nursing to advanced practice. We must pay rural and scarce skill allowance consistently and promptly. Secondly, infrastructures and occupational health safety. And this cannot be effective if she has no accommodation, running water, electricity, or a secure working environment, PPEs, and all that. Government must fast-track clinic renovations and staff housing. Stakeholders can adopt facilities. Thirdly, the mental health and wellness for the nurses. Establishment of confidential nurse wellness funds or counseling services for burnout and vicarious trauma, I think, is a necessity. And fourthly, we need a continuous professional development. These are trainings amongst the nurses. At least the government, with the head professional council and educational institutions, must subsidize and provide mandatory, accessible CPD, continuous professional development, so that a nurse who is in Katima Mulilo has the same upskilling opportunity as those that are living in the city. And finally, involve us in decision making as nurses. Most of our platforms that nurses have came up with proved that nurses have solutions. We must move from tokenistic consultations to genuine co-creations of policy. We don't just want to sit at the table, we want our fingerprints on the blueprint.
Well, in that spirit, Nurse Anjolo, what message is it that you'd like to share with your fellow colleagues in this profession?
Okay, my message is this: nursing personally chose me, and if your heart beats to serve, to heal, and to lead, then this is the most rewarding life you could ever live. This is not just a job. Nursing is not just a job. It's a license to touch humanity, and it's most vulnerable and it's most trampled. Yes, the system has its challenges, and you will work hard, but you will also change lives in a way of, in ways a paycheck can never measure. As a founder myself, I tell young people that nursing today is a landscape of opportunity. You can be a clinical specialist, you can be a public health strategist, you can be a researcher, you can be a health tech innovator, or you can be an entrepreneur like me. We need young tech-savvy, passionate Namibians to reshape the profession, bringing up innovations, bringing up digital skills, bringing up courage. I'm looking at my future colleagues, and my message is the profession needs your intellect and the nation needs your compassion. And I personally invite you to join the journey of transforming our healthcare, one patient, one community at a time, and it is worth it.
Well, Nurse Josephine Anjolo, happy International Nurses Day to you, and thank you so much for joining us here on the Daily Roundup this evening.
Okay, thank you so much.
Well, we're going to take a very brief break. We have some more conversations coming up after this. Stay with us here on NBC.